Welcome. Today we bring you another edition to our iMed Medical Program series right here from Channel I. And as of every episode, we will be discussing some important, crucial information pertaining to key problems that are happening on a communal health level in Sri Lanka. So please do stay tuned with us as we're about to bring you a great, memorable experience and an abundance of knowledge that could cater you and make your life a better place. Welcome. Today you're tuning in with us on Channel I for our next edition of iMed Medical Program series. And today we're going to discuss valuable information and certain things that we need to talk about as far as influenza and dengue is concerned. And today is someone very important, a consultant physician, Dr. Priyanka Jayawardena, who will be discussing valuable information about dengue and influenza. So we warmly welcome Dr. Priyanka Jayawardena.
Thank you.
So doctor, can you tell us what exactly is influenza?
Influenza is a viral infection, and it is not something new to us. It has been there in the town for many, many years. It comes time to time, so we call it seasonal influenza. So this is again the influenza season, May, June, July, August. It could be due to the weather changes. So it comes most of the time twice a year. So we talk about a lot because influenza is common these days.
Influenza, commonly known as the flu, is a highly contagious respiratory illness transmitted from person to person via droplets and small particles produced when infected people cough or sneeze. Influenza is also transmitted via hand contact with contaminated surfaces. Influenza symptoms include high fever, a dry cough, headache, sore throat, muscle and joint pain, and feeling unwell. There are three types of influenza viruses that cause infection in humans: types A, B, and C. However, types A and B are the overwhelming majority of flu viruses that humans are exposed to. Influenza viruses are unique. They experience high mutation rates and constantly change, creating new strains. Because viruses mutate frequently, new vaccines that best match the strains predicted for the coming influenza season are prepared each year. Influenza can affect anyone. People at highest risk include those aged 65 and over, pregnant women, Indigenous people over 15, young infants, and those living with chronic conditions.
And also, Doctor, one of the other issues that we have that is persistent and has been there for quite a while is dengue. Yeah. Could you elaborate on what dengue is?
Dengue is like influenza, again, it's a viral infection. So the people talk about dengue because we had some deaths in the past and people are dead scared of dengue. Both influenza and dengue are somewhat similar, because the origin is a viral, and it could be dangerous, both conditions. But I should say that both conditions most of the time won't do any harm to the people. Most of the time they recover without any problem. So I don't think we should have unnecessary fear about both conditions.
Transmitted by mosquitoes, dengue fever is a threat to almost half of the world's population. Dengue is a major public health problem, particularly in Latin America and Asia, where outbreaks occur regularly. When biting a person for its blood meal, an infected mosquito releases saliva containing the dengue virus. Once in the body, the virus infects the immune cells in the skin tissue. And enters the lymphatic system. The viral infection can then trigger a strong inflammatory reaction. During the incubation period, the virus first replicates locally. then spreads into the bloodstream of the infected person. This is called viremia. For some patients, especially children, the infection may cause severe forms of the disease, including dengue hemorrhagic fever. The blood vessels become permeable, resulting in plasma leakage. Ultimately, dengue hemorrhagic fever requires intensive hospital care. When a mosquito bites a person who's already infected, it draws in the dengue virus contained in the blood. By biting another person, it can transmit the virus and spread the disease.
And why is it considered very dangerous? Why do people still die? I mean, it has been a very persistent problem regardless of the education and the awareness that has been given to society. Why does it still keep happening?
Well, the deaths due to influenza and dengue are due to two different reasons. If you ask influenza, it's a viral infection. It mostly affects the lung. And people who end up with pneumonia could have a worse outcome. And we have identified some high-risk categories in influenza. For example, children less than 2 years old and adults more than 65 years old, pregnant ones. And people who have chronic medical problems like poorly controlled diabetic, kidney failure, liver problem, people with liver problems, and people with asthma and chronic lung conditions, they are identified with as high risk group. Some people, they are on regular medication, affect the immune system, and people have with HIV, and those people belongs to the high risk group. So if they get influenza, they could end up with a worse outcome. But on the other hand, we have got lots of otherwise healthy people who have got influenza, and there are some reported deaths as well. Again, the reason is when somebody gets influenza, I think it's a viral infection, they should see a doctor and take proper medication. And most importantly, they should stay at home. So if you don't do that, you could end up with a worse outcome. Dengue is different. Dengue doesn't affect the lungs. Again, in dengue, many people, large percentage of people, nothing happened. It's just simple viral infection. They recover without any problem. But some group, small percentage, could go to a condition called dengue hemorrhagic fever, and that is the group where they have a bad outcome. But the medicine and the knowledge among the doctors regarding the influenza and dengue is very good, especially in our country. So the management, we have guidelines from the ministry, and we work according to the guidelines. So I don't think people should fear about it.
And what are the preliminary symptoms that, because some people make a mistake by not getting checked, and prolonging that could cause dengue to escalate into a fatal level. So what are the preliminary symptoms that people shouldn't underestimate when they get?
Well, these days, if somebody gets fever, headache, muscle pain, joint pains, and pain behind the eyes, without any other symptoms, that is dengue. So in those group, the dengue antigen may be positive or negative, regardless the test results. If somebody comes with fever, headache, joint pains, muscle pains, that is dengue, unless proven otherwise. But if somebody comes with again the same symptoms like fever, headache, joint pains, muscle pains, plus sore throat, cough, nasal discharge, that is influenza. So again, influenza antigen test may be positive or negative, but if the person is having those symptoms, that is influenza. That's why usually we don't recommend to do the dengue antigen and influenza antigen, because dengue patients may have negative dengue antigen test. Influenza patient may have negative influenza antigen test, so it won't do a big job.
And once you're diagnosed with a certain condition like dengue or influenza, are there any specific life habits or nutritional needs that has to be met in order to kind of kickstart the process of recovery?
The both conditions, there are common things and the different things to practice. If in both conditions, if you are down with fever and above symptoms, what we mentioned, they should not go to work. They should not send their children to classes and school and sport meets, etc. Should stay at home. And to control the temperature, the paracetamol is the only recommended medicine, and both conditions need adequate nutrition and good amount of fluid to prevent dehydration. When it comes to the influenza, for the symptomatic treatment, what we give in addition to the paracetamol, to reduce the secretions and cough and cold, we use medication like chlorpheniramine, that kind of medication. And people start sneezing a lot, it is very uncomfortable, and these nasal secretions could transmit the virus from to another person to person. So prevent that, we give nasal drops, nasal decongestant. If somebody having cough and wheezing, we start inhalers, that little gadgets where people have to inhale, ideally with a spacer like small gadget. And people who are really sick need to be nebulized, that giving a gas thing of salbutamol or ipratropium, preferably in the hospital. And if the person is really sick, he may need oxygen.
Now, let us learn the breathing pattern required for your metered dose inhaler. What if you choose to breathe in quickly and deeply? If you breathe in quickly, the medicine will stick to the back of your throat. This is because the air stream will directly hit the back of your throat. What if you choose to breathe in very slowly? If you breathe in very slowly, this will cause the airflow to stay in your mouth for some time, and the medicine will be delivered on the sides of your mouth and tongue. You have to breathe in slowly and deeply for the medicine to reach your lungs directly. Learn to breathe through your mouth slowly and deeply from our tool Learn to Breathe. Breathe in and breathe out along with the breath bar. Remember, syncing your breath with the breath bar will help you learn to breathe in slowly and deeply. Learn when to press the canister of your inhaler. What if you choose to press the inhaler after you breathe in completely? Pressing the canister before or after breathing is the common mistake. Medicine sticks to your tongue as there is no airflow to take the drug down the lungs. Learn and practice when to press your inhaler from the real instructor in our Learn to Inhale tool.
There's a little difference between the dengue and influenza. Influenza, we have a specific medication, antiviral, called oseltamivir. It's very effective and it's very specific to the influenza virus. But we don't recommend oseltamivir. We don't recommend oseltamivir to each and every person because it's not necessary. But if somebody belongs to the high risk group, which I mentioned, we feel that he is a candidate for oseltamivir. But we don't give the oseltamivir as an outpatient. It's not available in the pharmacy. If person needs antiviral treatment, they should come to the hospital, government hospital or private hospital, and consultant should decide whether the person needs oseltamivir. Why we don't give it as outpatient in the local pharmacy for people to buy freely? If they use this medication without proper reason, and our country is notorious for antibiotic resistance, and if they don't use the the proper dose for proper duration, so at ideally 5 days, the people and society might develop a resistance to the virus. To avoid that, we minimize the use of antiviral and we give only to the people who need it. Dengue, there's no specific antivirus. It's basically a fluid management.
And from a general perspective, doctor, people often make a mistake when they go through certain symptoms of having cough or having sore throat. The first thing that comes to their mind is, oh, it's probably a bacterial infection. So they take antibiotics and they kind of make a detour from the correct process of recovering. So what are your thoughts on that?
That's a very sad scenario. Sri Lanka is numbered as one of the countries who have highest number of antibiotic resistance, because antibiotics used as a over-the-counter medication, people or the pharmacy decide giving antibiotic for various reasons. In conditions like dengue and influenza, antibiotics are not necessary and it may do harm even, and it is a waste. And when people use antibiotics unnecessarily, the society develops a resistance to that. So whenever you have to use for the proper person, it may not work, and it is happening now. Having a fever is not a bacterial infection always. Most of the time it's viral. Even cough and cold, sneezing, again not a bacterial infection. Most of the time it's viral. If somebody is going to take antibiotics, they should send a sample, blood sample or sputum sample or urine sample to test for the bacteria, to identify the bacteria and see what the sensitivity pattern, and then only we should start antibiotic, not haphazardly. Dengue, there's no place for antibiotics unless very, very complicated cases. Then definitely the person is in the hospital, then doctors will decide the antibiotics. Unfortunately, our primary healthcare system with family physicians and general practitioners is not very well organized, and it is not being monitored, and those doctors, they don't get the proper continuous medical education, and it may be maybe economics and business reason the people are ended up with antibiotics. So I think if somebody prescribe antibiotic to a person, the sick person, the person with fever, should ask from the doctor whether it is necessary or essential to take the antibiotic.
So doctor, if we can further discuss more about the investigations that have been carried out pertaining to influenza and dengue, how is the situation?
The investigations, I think we should talk about the investigation which we should do as an outpatient. When somebody gets fever, people tend to do a full blood count day 1. I think it's not necessary. Usually day 3 is the best day to do the full blood count. But in pregnancy, we prefer to do a full blood count either day 1 or day 2 to have an idea about the baseline results. But otherwise, day 3 is the best day to do a full blood count. But some people, they are concerned about doing a dengue antigen and influenza antigen. Both are expensive investigations and both are not essential. Dengue antigen, best day to do is day 2, second day, if you are doing. But if the dengue antigen is positive, that means it's positive, it's dengue. And if the dengue antigen is negative, still it could be dengue. So if somebody comes with correct clinical picture, and if the dengue antigen is negative, still we have to consider, and he should think that he is a person with dengue, and he should take proper precautions, and he should do another count, day 3, day 4, day 5, maybe daily full blood counts to see the specifically the platelet count. And if the platelet count is coming down less than 150,000, he should come to the hospital, and most of the time we admit these patients and treat them as inpatient. The problem is dengue antigen test is, if it is positive, even day 1 or day 2, people tend to come and get admitted to the hospital, which is not necessary. The other thing, when the dengue antigen is negative, people think it's not dengue, and they send the children to the school and go to work, and they come to the hospital in kind of a critical situation. That's the problem. Influenza antigen, again, it's an expensive investigation, and we usually don't recommend. As I told you, if somebody comes with fever, headache, joint pain, muscle pain, with cough and cold and sore throat and dry cough, that is influenza unless proven otherwise. No need to do the antigen test. Other thing, that if it is positive, it's positive, it's influenza. If it is negative, if those symptoms are there, still it is influenza. The treatment that depend on the category of the patient. If the patient is high risk, we start antiviral, otherwise we don't. Other investigations are like full blood count, and nothing much. If the patient comes to the hospital, then we tend to do the test like C-reactive protein and chest x-rays, but I don't think people should think about those investigations from the beginning.
And doctor, currently the situation in Sri Lanka, regardless of the education, the awareness, and the social initiatives we do to address issues with these problems that are happening, still it's a persistent problem. And what kind of precautions should people watch out for? Because I feel like no matter how much people are educated about this, there's a reason why it's still persistent. So what kind of precautionary methods should be followed to kind of prevent and stop this influenza or dengue from happening?
Yeah, two diseases are different, though both comes from a virus. Dengue is a mosquito-borne infection. So first thing, we have to reduce the mosquito breeding places. We all know about it, the places where the mosquito breeds. First thing. Second thing, we should try to reduce the mosquito population by fogging or putting chemicals or putting bacteria and those things. Thirdly, the mosquitoes are there, we should take precautions to prevent them biting us. That is by using mosquito repellents, maybe creams, maybe mosquito nets, or wearing the shirts like this, the long sleeves shirts like this, because the mosquito can't pierce the cloth and bite the skin. And so those are the things for prevention of dengue.
One. Eliminate standing water. Mosquitoes breed in standing water, so eliminate any standing water in and around your house. Look for water accumulating in places like empty planters, flower pots, fridge trays, storage or garbage bins, cans or any empty container. 2. Use good mosquito repellents. To get rid of mosquitoes around your house and keep them away from you, use mosquito repellents. Apply a good mosquito repellent on any exposed skin. You can make an organic insect repellent at home using ingredients like witch hazel, vanilla extract and essential oils like lemon, lemongrass, lavender, peppermint, eucalyptus and citronella oil. 3. Stay in air-conditioned or well-screened housing. Attach screens to all windows and doors where mosquitoes can enter. Always keep them closed and repair any holes in the screens. If possible, opt for air conditioning. Mosquitoes cannot survive in a cool atmosphere. If your room is not screened or air conditioned, use a mosquito net around your bed. 4. Wear protective clothing.
Cover as much of your skin as possible by wearing loose, long-sleeved shirts and long pants. Wear light-colored clothing, as dark colors like black and blue attract mosquitoes because insects and bugs can see dark objects more easily. Avoid wearing short-sleeved shirts or shorts, as mosquitoes can easily bite through thin clothes. 5. Use guppy fish in swimming pools. It can be difficult to keep the water in swimming pools clean, especially if you cannot cover them. An easy solution is to put some guppy fishes in the pool to control the growth of mosquitoes. 6. Avoid outdoor activities at dawn and dusk. Mosquitoes responsible for dengue fever are more active in the daytime than nighttime. Also, they bite more at dusk and dawn. Hence, avoid being outdoors at dawn, dusk, and early evening.
When it comes to the influenza, the situation is different. It's a viral infection. Transmission from one person to another person is droplet. If I am having influenza, if I cough or cold, sneeze, those droplets can go and deposit in another person. So if I cough or if I sneeze, these droplets go and deposit in another person. But usually the distance, if I cough from this place, the distance is usually 1 meter or 1.5 meters, not more than that. So if I cough from this place, the person who is in the other corner of the room should not get the influenza, because the viral droplets won't go that far. So that is one. Second way of transmission of influenza is the direct contact. That means a child who touch their nose and eyes, maybe touch the door or window or a bed, and another person, maybe the child parents, go and touch that places and get the virus from their hand, and then they touch their nose and eyes, they get the virus get the access to the healthy person. Third way of transmission influenza is via the fomites. Fomites are the various gadgets, maybe the inhalers, maybe the mask, or maybe the handkerchief and like that thing. And when somebody go and touch those things, it can go to the next person. So how are you going to prevent the transmission of influenza is a person who has got influenza, when they cough or when they sneeze, they should use preferably a tissue paper or handkerchief and avoid transmitting the droplets of the society. And when they should minimize touching their nose and eyes, because when they touch their nose and eyes, when they touch another person or another instrument, it can go to the next person. And they should they should wash their hands after touching the nose, eyes, or maybe their handkerchief, whatever. Then it won't go to the next person. And they should wear a mask. And they should stay at home. They should not go to the community. They should be isolated, thinking about the others, maybe the family, maybe the society. And how the healthy person should take precautions to prevent it getting from a sick person. If there's a sick person at home, and if you are helping or nursing a sick person, you should wear a mask. Then these droplets will not come to the nose and mouth directly. And whenever we touch the sick person or sick person's utensils, maybe a handkerchief, maybe their inhaler, maybe their plates or teacup, they should wash their hands. And those are the two main things. And the other important thing is, when there's a sick person at home or hospital, the things he used, maybe handkerchief, maybe clothes, what do you mean, and the linen, and we should clean them or sterilize them, those things properly, and the person who handles those things should wear a mask and gloves. And as the influenza is going on everywhere, especially the high-risk people who have got maybe the pregnant mother, maybe person with chronic medical problems, they should avoid going to crowded places unnecessarily, like cinemas and places like that. Those are the things that we could do to prevent the spread of the infection in the community.
Global epidemics of influenza have occurred for hundreds of years. There were 3 pandemics during the 20th century. They occurred in 1918, 1957, and 1968. The 1918 pandemic took the largest toll, causing an estimated 50 million deaths worldwide. The first pandemic of the 21st century began in 2009. But how does a pandemic occur? Influenza A viruses vary slightly from year to year, a phenomenon called antigenic drift. These small variations are the reason why the vaccine must be updated every flu season. Influenza A viruses also can undergo dramatic genetic changes called antigenic shift that may cause a new influenza strain to which we have little to no immunity. If this strain spreads easily among people, it may cause a pandemic. The immune system targets 2 proteins on the surface of influenza A viruses, hemagglutinin and neuraminidase. Hemagglutinin has 16 confirmed subtypes of proteins. Neuraminidase has 9. From these protein combinations, scientists name influenza viruses. For example, an H5N1 virus contains hemagglutinin subtype 5 and neuraminidase subtype 1. Antigenic shift can occur when 2 different influenza A viruses circulating in the environment infect and multiply inside the same cell. While inside the cell, these parent viruses can exchange or reassort genetic material and create a new virus. Through reassortment of the 8 gene segments of each virus, there are theoretically 256 possible virus combinations. Pandemic viruses also can emerge in other ways. Among these is adaptation. Scientists believe that the 2009 H1N1 virus was the product of 2 influenza A viruses that were circulating in pigs. The viruses are thought to have reassorted and adapted to create a new virus capable of infecting people. If an emerging virus transmits efficiently from person to person, it would be a challenge for scientists to produce an effective vaccine fast enough to limit its spread. That is particularly true with the amount of international travel that occurs today. In a matter of hours, one person infected with a new form of influenza can spread the virus to people in another part of the world.
As we discussed an abundance of valuable information, we sincerely thank Dr. Priyankar Jayawardena for joining in with us and keeping us posted about all the crucial things we need to know as far as dengue and influenza is concerned. So we thank you very much.
Thank you.
Hello there. Hope you had a very thought-provoking, fruitful session with us from this time's IMED edition. So, while giving the advice that it's important to take care of yourself and have a healthy domino effect on society, it's time for us to wrap up with that thought. So, see you soon until next time. Until then, please do take care.